from the University of Toronto, DNP from the case, Western Reserve University, and she was selected first Young Alumni Award for Excellence and of the Francis Payne Goldman School of Nursing. And I'd like to present to you Dr. Chavez.
Touching, rather nostalgic event for me. And I owe this to the Philippine Nurses Association of America, who adopted me during the induction at the American Academy of Nursing. Do we have Canadians in the room? Anyways, those of you who have friends, families, relatives in Canada, who know people a lot. Through the 2 days I was here, I hear people talk about, oh, my sister is there, oh, my friend is there, blah, blah. So clearly there are Canadian nurses, but we don't have an association. PNAA has kindly volunteered to help us get organized. So please let the people you know from Canada, I am a fan of PNAA now. I immigrated to Toronto in the early 70s, almost 45 years ago. And I know that most of us have very interesting immigration stories. I just want to share mine very briefly because it really aligns to my topic of nurses as global citizenship and my passion in global nursing and global health. I recall as a student nurse at St. Paul College, Manila at the time, and this was before 1976, I was quite annoyed when people told me, oh, you're going into nursing because you want to go abroad. I think it was because of the example that my parents had. In spite of health professionals' opportunities abroad, they decided to stay home. My late father was a physician who went to the rural areas to give free consultations. And the patients would come back with prescriptions, bring it to my mom's drugstore, and of course we wouldn't have the money, and then the prescriptions would have to be given for free. Additionally, since they were the only ones left in the Philippines, my grandparents had left their fish farm business with them, and they really didn't know what to do with it. Then martial law was declared, and we in Pampanga was also impacted by the New People's Army. So that was my push to leave. I joined my friends to get a visa for the US, but coincidentally my aunt who was in Canada visited, and at that time, Canada was open to family sponsorship. So, and you become an immigrant right away. So that's my story. So we've been in Canada for almost 45 years. Our family has grown. So all my family's there, and I have not been able to come back. So I thank you very much for this opportunity of being in our homeland to speak to you, my colleagues. I also enjoyed the Balituro that I joined the PNAA last week. My topic today is nurses as global citizens and interprofessional collaboration. I thought the best way to spend the time is to really look at reform in health professional education. And with this, I'm going to focus on three things. One, educating nurses for global citizenship and collaborative practice. And since interprofessional education has seemed to be a recurring theme in the presentations and in literature, to look at values, philosophies, and theoretical perspectives that underlie interprofessional education. And if we have time, show you some examples of partnerships and nurses' role and leadership role in the global stage. The world has become a global village, and Constitution calls for people to be global citizens. Just a little definition of globalization, and those of you who have been watching the World Economic Forum at Davos, you can see that this isn't going to go away. So globalization really increased our interconnectedness and interdependence of peoples and countries. What happens here, what happens locally, has an effect globally. The word global. Globalization requires to extend our own responsibility beyond our national citizenship to global citizenship. I know that we Filipinos are further in this journey. My frame today is really to show you the attempts that we make in Canada, in my university, to graduate nurses as global citizens. And my message to you is please don't be shy about talking to them about our culture, our context, because that would be a great learning experience for them. So what is global citizenship? It's a commitment towards social justice and critical thinking, appreciate the complexity and ambiguity of global issues, and understanding the link between local action and global change, the globality. So, public health challenges, as we know, and cross-border health risk of a new magnitude we've talked about yesterday, increasing mobility of people, crisis in health workforce, increasing migration of nurses. Our nursing contribution, mostly caregiving, is the biggest contribution of nursing to the world, happens in a global context. And nurses must be able to not only deliver competent care to individuals, but also place individual care within the context of a comprehensive view of complex societies. And this is where I talk about sharing with our international colleagues our culture and context. What works in the US and Canada may not work here. And I find that, like I am today, I'm learning more and more that I can share. We'd like to graduate nurses who are global citizens with a moral responsibility beyond local communities and national citizenship to be citizens of the world. And this are the three capacities: ability to critically evaluate oneself, a sense of commitment to humanity, and ability to see the other points of view. And I was struck by Dr. Borromeo's first test about the E. We should really consider multiple voices, really not just from the traditional Western point of view. In an attempt to, one strategy that we used is to design a course called Critical Perspectives in Global Health. International placement has been gaining more and more popularity, so our students were doing the same thing. However, we wondered whether A, it was academic tourism, it was very colonial thinking that West is best and that they were going to save the world. So we thought, okay, let's really exploit this interest, but prepare them properly to go abroad. So, and most of them are very privileged, so we wanted to dislocate them from their comfort zone. So this is just a slide that summarizes the course objectives in the blue, examples of students' learning objectives, and here are the preparatory sessions, interprofessional collaborative practice and core concepts in global health, ethical considerations. We use the pedagogy on a post-colonial feminist perspective, safety abroad, local health system, and then students who went before would come and talk to the incoming students. And you could just, I'll give you a minute to really read the student comment. So it was surprised to learn that nurses are trained to a much larger scope of practice than nurses in Canada. So they actually had things to teach us. In the first presentation by Dr. Divina Gracia, I was quite impressed with how nursing here in the Philippines has really moved forward. Realize the deep potential nurses can have on international collaborations for healthcare, especially in public health. Just pictures, it happens to be that we send them to resource-constrained area in India for 4 to 6 weeks after the 6 months of preparation, and then they come back and do a debrief. One of our main goals is to have students learn what it is like to be the other. All of us, when we immigrated, I'm sure, have had kind of this feeling, right? So when you're the one who's different when you're working internationally, don't understand the language, the culture, and don't know how to act in certain situations. These experiences help you to gain an understanding of what it's like to be a newcomer and out of your own culture and comfort zone. It's really amazing the kind of self-development and the difference in worldview when they come. We ask them to blog every week about when they felt like the minority person, what assumptions they brought in or challenged, etc. Just to show a slide on the framework that we use in post-colonial feminism. And we use this so that the students can contextualize their care and become sensitized to gender oppression, reflection on the ways that colonialist values are reproduced, and challenge these values as part of practice. So we heard earlier from Leo about reflective practice with the core values of equity, social inclusion, reciprocity, and sustainability. So they do reflexive summaries once a week and a summary at the end of the course with guided questions based on the post-colonial theoretical framework. Importance of care. What works in Canada may not work here, and it's important to work with colleagues. Initially, the course was for nurses, and it caught the attention of the university, so it became an interprofessional education. I just want to now talk a little bit about interprofessional education, which has been a recurring theme and literature abounds in it. As you know, with the transformation of health disciplines reform in Lancet, etc., talks about health professionals are traditionally educated and socialized through our own systems from those of other healthcare professionals. Nurses, doctors, OT, physios, etc. We're all socialized and educated in silos. Professionals often develop different perspectives on issues. Naturally, situations in healthcare practice when professionals disagree with one another. So a new vision, if healthcare professionals are expected to work together and share expertise in a team environment, it makes sense that we should be prepared together. At the end of the day, it's the patient who's in the center, but if we don't understand each other's scope of practice, it's going to be impossible. At the University of Toronto, since 2005, interprofessional credits are required before the 11 health disciplines can graduate. So medicine, nursing, physio, psychology, social work, and the 11 of them have required courses before they can graduate. One example is the whole week on conflict management, because that's a very common thing that we all have to work through. Just the mechanisms that shape collaborative practice, again, are governance models, shared governance, structured protocols, supportive management practices, conflict resolution policies, etc. I'm rushing this through because I know you guys want to have lunch. Okay, now interprofessional education isn't just for that. We're doing it because we want to graduate collaborative, practice-ready health professionals. And when we are collaboratively practice-ready, we have better patient outcomes and better health outcomes. Enablers and barriers. I talked a little bit about enablers. Barriers are professional cultures and stereotypes. Accrediting body for nursing, different from medicine, and there is really no interaction. Hierarchical roles and relationships, accreditation and curricula are all different. So the vision for collaborative practice is from individual care to a collective focus. Hierarchical, but equality among and across professionals. Profession-centered, to patient-centered care, individual focus to communities and populations, competition to collaborative practice, self-centeredness to humanistic and holistic. I had a great opportunity to work at the World Health Organization to use the framework that was published to look at 6 countries as case studies, nursing and midwifery perspective on interprofessional education and collaborative practice. So we looked at India, Brazil, South Africa, US, and Canada. And the previous slides that I showed you really demonstrated that IPE and collaborative practice has many advantages to move forward in collaborative care. When in Balituro, I talked about health systems leadership and opportunities of nurses in the global stage. And I was talking about the many reports recently that speak to the opportunities that abound for nurses and our engagement. So I just wanted to show you a couple of the reports. The strategic direction, institutional partnerships, and give you some examples. This is one example in Brazil where it really typifies government, academia, and practice. We were very proud that the Brazilian government came to us and said, help us articulate the leadership role of nurses in primary health teams. Brazil, like the Philippines, has a very good primary healthcare system. As a matter of fact, it is in their constitution, and it's one of the countries that we reviewed in the slide I spoke about earlier. So typically, the silent majority who do all the work, who are those people? The nurses, really did not have a very good presence, but it was the physicians. So with our colleagues from a few of the universities in Brazil, we worked together on a curriculum with a whole suite of needs assessment, curriculum design, and then the implementation and evaluation. This is where, again, I can't emphasize enough how important it is to look at the context of the country you're working with in order to be relevant. Then additionally, what happened is that it went to government as well, so we had the opportunity to work with government and say, okay, here is what the whole specialization course in primary health care is. You have all of these nurses, and it also extended to interprofessional. They are ready to lead, and so the implementation of the primary health care policies moved forward better. So it is very much a capacity building, called it nursing leadership and capacity building in primary health care. And so here are the graduates who now are holding key government positions and official leaders of primary health teams. Another partnership in Ethiopia, again in terms of capacity building, is really getting the nursing education to be more at an advanced level. We're working with them to develop their master's program. The India-Canada partnership, we send our students over, and what we try and offer is a specialization program for our colleagues in India to do primary healthcare specialization. In Spain partnerships, there is the Erasmus, which is a European funded. Is anyone here in the Philippines, any partnerships with that? They're really looking into international partnerships. I've invested a lot in that. Erasmus is faculty exchanges and student exchanges as well. Visiting professors back and forth, international PhD program, and really working with them now and they're enhancing their internationalization strategy. I put this slide in just because I'm so impressed about our neighboring China and their investment in nursing education. We receive more students through the China Scholarship Fund, sandwich PhDs and faculty visiting, etc. I gather that in order to get a promotion, they have to have some international experience in education. I put this on as just sort of the high-level global agenda, universal health coverage, which has been spoken about, sustainable development goals, primary health care, non-communicable diseases, and interprofessional education and collaborative practice. The Sustainable Development Goals during Badingturo, one of our colleagues, Dr. Hermosa, spoke about this, and I was so pleased and proud to see that a lot of the Filipino colleagues were really quite invested in this. So although number 3 is the only one that's health-related, we know that health is a multiplier and it impacts all of the others. So we really, as nurses, have a key role in the Sustainable Development Goals. So I hope I left you enough time to eat, but I just want to leave you with some reflections. How to graduate nurses as global citizens and integrate global health in the curriculum. Most of the lecturers and professors have not been educated in the subject, and many conservative thinkers among us would claim that a global health for all social will collapse. And I quote. And, you know, not only for knowledge, but also for our caring and charismatic qualities. How to address social transformation among nurses when there's a strong belief of powerlessness in the profession, and therefore nurses do not perceive themselves as agents of change and as capable of transforming healthcare or political structures. We are all very knowledgeable. There is almost 20 million of us across the globe, the largest single health profession. In North America and Europe, for the past 15 years, year after year, nursing has been ranked as the most trusted profession. So there you go. So how can interprofessional education and collaborative practice be a turning point for nursing voice to be more powerful and more impactful? Unfortunately, we are better heard when others who enjoy greater accepted value and power join to affirm our cause. And IPE can be a turning point. Who are those people? Doctors have enjoyed this power and privilege. One of my strategies is to co-design a course with a colleague physician in global health and primary health care to family physicians. And it's just so humbling and amazing how the physicians didn't really know are in nursing, and that is an opportunity to share with them our knowledge. I'll leave you with some of their references, and sorry I rushed through this because we were late, and I'd like you to have a proper lunch. So, there is my contact information. If any one of you, please contact me. I'm happy to. One of the valedictorian students asked, why is there no partnership with the Philippines?